Good evening, everyone, and welcome to our webinar on cataract surgery. My name is Jane Steich, and I'm the Eye Unit Manager. I'm joined by our consultant, Ms. Sarit Lesnick-Oberstein. She's our consultant ophthalmic surgeon. This presentation will be followed by a question and answer session. So if you'd like to ask a question during or after the presentation, please do so by using the Q&A icon, which is at the bottom of your screen. This can be done with or without giving your name. Please note this session is being recorded if you do provide your name. If you would like to book your consultation, we will provide you contact details at the end of this session. And I'll now hand you over to Sarit, and you'll hear from me again shortly.
So good evening, all. I'm going to talk about what cataracts are and what can be done about them if necessary, and give you a few explanations. And as Jane just said, we can do some questions afterwards if you want to ask any particular questions. So as Jane said, I'm Sarit Lesnick-Oberstein. I'm a consultant ophthalmic surgeon. And Jane is the lead of our eye unit, she's the eye sister. So we're going to go through the types of cataracts, the causes, the symptoms of cataracts, and what cataract surgery entails and what it might mean for you. And we'll go over some of our consultants who work here and also what the options are for different types of lenses should you want to go for cataract surgery. And I will explain that to you in a second. So I myself am Dutch, but I trained my ophthalmic training at Moorfields mostly, and then I'm also a retina surgeon as well as a cataract surgeon, though we do not do retina surgery at Benenden. And I also did a PhD, so I'm also an academic, and I worked in Amsterdam for 13 years before I came back to the UK, where I work now also in Benenden and some other locations. So first of all, what is a cataract? Now, cataract is when the lens inside the eye goes a bit cloudy. So the lens is the white bit that you can see on your screen. And that basically, when you're born, should be clear. And as we get older, like everything else, it changes its structure, which means it becomes cloudier and vision can become less clear. So it's like a camera. Every camera has a lens in it. And the lens needs to be clear. And that lens paints a picture on the retina, which is the film at the back of the eye, like in a camera, that sends messages to the brain that lets you see things. Now, as you can imagine, if that lens gets cloudy or isn't working properly, the image that goes to the brain will be cloudy as well. So here you see a picture of that, where there's a picture of an eagle, and what the eye sees is a clear eagle. And when you have cataract, it either goes cloudy or blurry, or what some people notice is that things become dazzled, like when you're driving, that night lights will dazzle you, or that if you look at a bright light in the sunshine, that dazzles you as well. So there's different types of cataracts. And the most common one we see is nuclear sclerosis. Now, you obviously don't have to remember the name. It's just one of those things that as you get older, the lens will change color. So it'll become browner, which means that you will see colors differently. And also that it is more difficult for the retina to get all the light that is falling into the eye, because it is basically being filtered out by this brownish cataract. And that means that your image that you are seeing will be less clear. Now, this is another type of cataract. It's a cortical cataract, where you can see the little spokes that are kind of coming over the lens, the little white lines. And those will cause lots of dazzle, especially when you're in bright sunlight or when you're driving at night, and will make it very awkward to drive because you can't see properly, especially in the evening or when it's dusk. And then this is what we call a posterior subcapsular. This is right at the back surface of the lens, which is a very specific type of cataract. And that again causes lots of light sensitivity, but it is also, if it becomes larger quite quickly, can actually make your vision go very badly, make it very poor in a short space of time. So those are just three typical types of cataract. And then this is a posterior polar. We don't see those very often, but they're bang in the middle of the lens. So again, they cause a lot of dazzle and can make vision very awkward in bright light situations. So what can cause cataracts? Now, the most common cause for cataract, and so as I said, all it is that the lens has gone cloudy or unclear. It's not a skin growing over the eye or anything like that. But what can cause cataract most commonly is age. as we all get older, we will all get cataract, and we only do something about it when it starts bothering you. So the other thing that causes cataract is smoking. Things like diabetes can cause cataract. You can be born with them, but obviously we don't deal with that here, and that is not relevant to people interested in having cataract surgery here. You can have it after an accident. If you've had a big knock on the eye, that can cause cataract. And sometimes certain medications can cause cataract. But most of the cataracts that we see here at Benenden are related to age, occasionally to diabetes, or a mix of both. So what are the typical symptoms of a cataract? As I said, faded colors, blurry vision because that lens has gone cloudy, sensitivity to glare, especially at night when driving, car lights become horrible. And you have another symptom, which is that you constantly change your prescription. You constantly feel like your glasses aren't right, that the glasses aren't clean, that you need to clean them all the time. And that is a common first symptom of having cataract. And then there's a bit of double vision, though that is less common. So why would you want to have cataract surgery? Well, the most obvious thing is that you are affected in your daily life. So if you cannot do the things you enjoy or the things you need to do, if you're still working, then it is worth considering cataract surgery. The other reason would be if you can't drive legally. So there is a legal limit for driving, and if you fall under that limit because of your cataract, then obviously it is worth having cataract surgery if you want to continue driving. If you need to change your glasses frequently because the prescription keeps changing, then that becomes a very expensive proposition for every pair of glasses. It might be worth considering having the cataract done as well. And then if you can't do your hobbies, so if there's things you really enjoy, like sports, a lot of people play golf, they can't see the golf ball, or painting, or reading, or just doing normal activities that you enjoy, then it's worth considering having a cataract surgery if that is what the problem is that is causing your vision to not be as good as you want it to be. So what are some clinical reasons, so medical reasons to have cataract surgery? There's something called angle closure glaucoma, where the lens inside the eye, the cataract becomes quite large and it compromises the drainage of fluid from the eye, but that is a medical indication, or sometimes as part of other procedures, or sometimes your diabetic eye screening clinic might send you over to have your cataract done because they can't see the back of the eye properly to make sure that you're not developing any problems with your diabetes at the back of the eye. But these on the whole are less likely than your normal age changes and personal reasons for having the cataract, like quality of life. So a nice example of what cataract can do to your vision is the painter Claude Monet, who, when he was painted in the Impressionist style. And one of the reasons that he started painting in the Impressionist style is because he had cataracts, which were diagnosed in 1912. And it meant that things he was seeing were blurry. So his garden in Giverny, that used to be a nice green garden with beautiful colors, became murkier and browner because the cataract is brown, and it became indistinct. And it's very clear as his paintings progressed that his cataracts were getting worse, and they didn't have the option of normal cataract surgery at the time. So that's just an example of a very famous person who did suffer with cataract and what it did for his vision. So cataract surgery itself, what does it entail? Well, first of all, you have to come in for a preoperative visit. And at that visit, we first of all check your general health and make sure that you're fit and well to have surgery and that your blood pressure is all right. And if you're diabetic, that your blood sugar is all right. And then we do some other investigations which are important for deciding which lens we're going to put in the eye. Because if we take the cataract out, which is the lens of the eye, we have to put another lens in, otherwise you wouldn't be able to see clearly, just like a camera. So we do something called a biometry, which measures the front curve of the eye and the length of the eye, and that gives us an idea as to which lens you would need to see properly. And then we also scan the back of the eye to make sure that the back of the eye, the retina, and the center of your vision are healthy, and that there's no other underlying problems that might need treatment at the same time. You will also see your consultant, and there's a group of consultants here, which I'll show you later on. And they will do an eye examination and will discuss what's going on with your eye and make sure that you're otherwise fit and well for surgery. And then we will also discuss the local anesthetic. Most of our eye surgeries are done just using drops on the eye. So eye surgery is actually painless. You don't feel it. It's nothing horrible. It's just lots of water and lights. And all we need to do is use drops for that. So nothing nasty that happens. And then we obviously have to discuss the risks of the operation as well as the benefits. And then we choose which lens is most appropriate for you. And then we ask you if you're happy with everything, and if you've asked your questions you need to ask, and if you understand the explanations, whether you want to sign the consent form that we need before we do an operation on you. So there are different types of lenses that we use for cataract surgery. The most straightforward one is a monofocal lens. This means that we make you good for one distance and not different distances. And most commonly, that would be driving vision or distance vision, so that you can see well in the distance, but you would still need reading glasses. Now, the other option for some people who've always been short-sighted, who like to read without glasses, is to make you good for reading, but then you would still need glasses for distance. So those are two most commonly chosen, but most common is really the good for distance vision, so that you can actually do your day-to-day activities without wearing glasses, but you would still need glasses for the computer or for reading. Some patients have something called astigmatism, which means that the eye isn't round but shaped like a rugby ball. At that point, if the astigmatism is very big, it means that you would still need glasses for distance and for reading. We do have different lenses which can actually solve the problem of the rugby ball shaped eye by putting a slightly different lens inside the eye that corrects for that abnormal shape and basically makes what you are seeing like the round ball. And that way you would be able to hopefully see in the distance without glasses at all. So that's important if you do have a large astigmatism, to realize that there is that option, though you don't have to take that option. That is personal preference to you. And then we have something called extended depth of focus lenses, which are lenses that work for distance, but they also give you the option of seeing things slightly closer up. So you're not completely dependent on reading glasses. And those, they won't let you read the tiny, tiny print, but they'll make you mostly independent of glasses. They're very nice lenses to use, and they're called EDOFs, extended depth of focus. And if you really want, you can also have an astigmatic correction in those. And those are basically good for distance and most day-to-day things that you need to read quickly. So you're not scrambling for your glasses when you're in the supermarket to read a package or something. And then the last type of lens is something called a multifocal lens. And as you can see in the picture, there's lots of little lines within this lens. And that lens actually lets you see in different zones of vision. So you can see in the distance, and you can see close up to read, and in between. And those are the most flexible lenses if you want to do everything without wearing glasses. However, they're not always suitable for everybody. And some people don't like them as much because they can cause glare and they can cause reduced contrast sensitivity. So if you're going to have those, you have to be very aware of what the possible drawbacks can be. And again, they can have an astigmatic correction as well. But these lenses definitely take a little while to get used to after surgery for some people. And so that is something that you would discuss with the consultant should you decide to think about this type of lens as well. So what happens on the day when you come in for your surgery? First of all, we do the pre-op checks. We make sure your blood pressure is normal, your blood sugars are normal, and we make sure that everything, all your paperwork's in order. And then we dilate up your pupils, which we need to do so that we can see what we're doing during surgery. So it'll just be the side that we're operating on that side, unless you're having both eyes done. And if you really need it because you're feeling very anxious, we do have some oral sedation, some diazepam, should you need it to feel a bit calmer. But most people don't need this at all. Make sure you're wearing comfy clothing, preferably in a slightly dark color, just because we do use iodine and it can get on your clothes. So you don't want your nice crisp white shirt covered in iodine drops. And make sure that you just eat and drink normally. It's a bit like going to the dentist. You don't have to be fasting. You don't have to stop anything. You take your normal medication, but don't drink any alcohol, obviously, beforehand, just because you'll feel a bit unusual if you do that. So what happens when you come in for the operation? One of our staff will come and collect you from the waiting area where your pupil has been dilating, and they'll remove the little pellet that we put in the lower lid just to help the eye dilate. It's got some medication in it. And they'll check your details and make sure the correct patient and that we've got everything ready. You'll have also been seen by the consultant to make sure that we're going to give you the correct lens. Then we walk you to the small operating theatre we have, and we put you in a chair that's exactly like a dentist chair, and we'll give a hair net to get your hair out the way and a little swab over your ear because water does tend to run down. And then we'll lie you down and we'll clean around the eye and we'll dry around the eye, and then you'll be covered in a little paper tablecloth just to keep everything tidy. And it's got some fresh air underneath so you can breathe normally. And we put a pillow under your knees to make sure your back's comfy, but you will be lying completely flat with your head. So you can't have a little pillow under your head because then we can't do the operation. And then you will be, you'll have a little clip between the eyelids. It sounds a bit awkward, but actually you don't feel it once it's in. And that helps keep the eye open. So you don't have to worry about keeping the eye open or anything like that. All you have to do is lie there, relax and breathe, and we'll take care of the rest. And then there's an operating microscope that's going to be hanging over you, which is a very bright light. And we ask you to basically look at the light whilst we get the procedure done, because if you can see the lights, we can see your eye. And you can listen to music, which is usually on in theatre. You can blink normally. There's nothing you have to worry about specifically. And we can help you along. And, you know, if there is anything worrying you, you can let us know. So that the procedure itself doesn't take very long. It usually takes under 20 minutes. And then you'll be out again. So some of the surgical things that are important is that we make a very small incision in the eye. It's not a big incision. It doesn't need stitches. And then we basically open the little bag that the lens hangs in inside the eye, and we take out the lens using some ultrasound. So it's not a drill or anything nasty. You'll hear a little vibration noise, and you'll hear the noises from the machine. And then we remove all the little bits of lens and we put a new lens inside the eye, which goes in like a ship in a bottle. It's all folded up and then it unfolds when it's in the eye, and it goes right into that little bag where your old lens was. And then we give you some antibiotics in the eye and on the eye, and you have a little transparent shield at the end over the eye just to protect it till the next day. And you can take it off the next morning and you use it to sleep for 3 nights just to protect the eye at night. So these are the little steps that I said. The first is called capsulorhexis, where we open the little bag that holds the lens very carefully. And then we remove the lens by something called phacoemulsification, which is the ultrasound. And then you can see the third picture is the lens being injected into the eye very gently, like a ship into a bottle, where it unfolds. And the little legs that you can see on it keep it in place. Excuse me. So the recovery, you might feel a bit of a scratchy eye or a slightly uncomfortable eye or a slightly bruised sensation, nothing that you can't manage with simple painkillers, some paracetamol. And then you're going to have eye drops for 4 weeks. That's to make sure you don't get any infections in the eye. And the vision will feel blurry for a day or so. And then after that, it starts clearing. And then at a certain point, you will find that the eye is healing nicely. After 4 to 6 weeks, you will go to see the optician. And then you will also be called by the clinic after your surgery, usually a week later, to make sure that you're doing all right and that you're not having any problems or anything you're worried about. We do also have a helpline, should you have any worries after surgery, that you can always call and we can answer any questions on that as well. So like any surgery anywhere on your body, eye surgery also has risks. Thank goodness they're very, very low risks, but they're not zero. So the most important risk that you would have to worry about is that the little bag that we put the lens into can tear. And it's a very low risk, but it does mean that the surgery changes. It then becomes what we call a complicated surgery, which means that the surgery might take longer, the recovery might take longer, and sometimes you might even need a second operation. But that is extremely unusual. But it is something that you need to be aware of if you go into an operation. The other ones that are really important, like anywhere on the body, are infections or bleeding, but those are extremely unusual. Infections tend to happen after the operation, either due to poor hand hygiene or other issues, but are very, very rare, thank goodness. All of this will be discussed with you by the consultant, when you come for your consultation. So we have a dedicated eye unit at Benenden. It's a very friendly, gentle environment. We've got the latest equipment. Everything's very high level. And we have 12 consultants working here who are all consultants. There's no trainees. And all of our team are dedicated to ophthalmology, to eye care. So all our nurses and everybody who works with us. And we've been doing this for a long time, and thank goodness successfully. So we're rated as outstanding by the CQC, which is always reassuring. And we have a high rating with the NHS care we give as well. So these are our consultants. Mr. Devereux does cataract and oculoplastic surgery. Mr. Kwok does cataract and retina care, medical retina. Mr. Lake is a refractive surgeon. I am a cataract and retina surgeon. Ms. Hawkes does plastics and cataract. Mr. Poon does retina and cataract. And then there's Mr. Borg, who does cataract. Ms. Luo, who does retina and cataract. Mr. Abashiha, who does refractive surgery. So he does the special lenses like Mr. Lake. And then there's Mr. Shahid, who does retina surgery, and Mr. Ong, who does the cataracts, and Ms. Bin Lee, who does a refractive as well. So should you decide to go for special lenses, you'd be seeing Mr. Lake or Mr. Abashiha or Ms. Lee. But you would be seeing any of us surgeons for your first consultation or for your cataract surgery otherwise. So we have a cataract patient who just wanted to give a testimonial. She had surgery with us.
Hi, my name's Delia. I'm a Benenden member. I had my cataracts removed in February and March. I have severe astigmatism, which was corrected. Over the last year, I've really struggled with reading. I couldn't read very small print, and driving was a real problem, a real struggle, so much so that I had to give up driving at night. I was offered toric lenses to correct astigmatism, and I chose to have one lens for distance and one lens for reading, which has been mind-changing because I've now been able to totally dispense with contact lenses and glasses. The procedure was really short, about 15 minutes, and nearly painless. There was really good follow-up after the operation. I was given a phone call 24 hours afterwards. I had a booklet given to me. I also had a droplet charge to help me put the drops in, and there was also a 24-hour helpline provided as well. In the 3 to 4 months since I've had the procedure, it's been life-changing. I've been wearing glasses and later lenses since the age of 11. I can now drive at night, I can read, I can swim without worrying about water getting in my eyes. It's an absolute miracle. Colours, the world seems a brighter place, and the colours almost jump out at me. I would 100% recommend Benenden Hospital. My treatment has been exemplary from start to finish. It couldn't be bettered.
So I think there's some questions. I can see one. So Jane will take the questions, and if I can answer, then obviously I will.
So thank you so much, Sarit, for that. It was really informative. We have a question from Mr. Hardy, who asks, can you benefit from cataract surgery if you have an epiretinal membrane in one of your eyes?
So, good evening. So one of the things that is important is how much epiretinal membrane is there. Obviously, it's two separate problems. One is the cataract and one is the epiretinal membrane. I think the thing is that if the vision is clearer, that can already, because the cataract's gone, that can make things easier for you. However, if you have a dense epiretinal membrane that's really disrupting your vision, then that would in and of itself need surgery. But if it's a very mild epiretinal membrane, then you would definitely benefit from having the cataract done if you have sufficient cataract to be causing you problems, yes. So it is worth having it assessed. And then when you're seen in clinic, because we do the OCT scan, you would know, or we would know, and discuss with you how bad the epiretinal membrane is and how would that affect your outcome as well. So we would discuss that with you. But I think it's worth having it assessed so you know what to expect. More likely is that you wouldn't have the multifocal lens option, because with an epiretinal membrane, that would not work as well.
Thank you. Mrs. Beveridge asks, will it make a difference with recovery as having both eyes done on the same day?
So the recovery is pretty similar whichever way you do it. If you are having a monofocal lens, we tend to do one eye and then do the other eye a short while later. Whilst if you're having multifocal lenses, we tend to do two eyes in one go because it's easier for you. It doesn't really make a difference. The main thing is that you will be putting drops in both eyes, and you obviously have to be careful. But that happens anyway if you're having one eye done. So having both eyes done is not really a big difference. It just means that what we do is we start off with the first surgery, do the first eye, and if you are happy to proceed and everything has gone well, that's when we do the second eye. So there's always a little break between the two eyes where we discuss with you that you're happy to go ahead and have the second one done and that we're happy to proceed with the second one. But for your recovery, it wouldn't make a difference.
Thank you. I have a question from Mr. Baxter. He had cataract surgery in 2019. And in the past 2 years, he's noticed that his vision has worsened, and he thought that cataract surgery was a permanent solution.
So, Mr. Baxter, it depends what's causing your vision to worsen. Again, that's something that needs to be assessed. One thing is that you might have something called posterior capsular opacification, or PCO for short, which means that the little bag that the lens is in has become a little bit blurry. And that happens because actually there are still little cells in there. It's a live material. And sometimes that can blur over a bit. Now, if that is what is the case for you, then that would benefit from some laser treatment, which we just do in clinic called YAG laser, YAG capsulotomy. If there is another reason for your vision to have deteriorated, obviously that would be something that would need to be assessed. So if there's something going on with the retina or any other part of your eye, but if it is just a little bit of blurring coming from the bag, the capsule as we call it, then that can be treated with laser and you would be back at the vision you had before with your new cataract surgery, as it were. So it's something that happens. Up to 40% of patients need a little bit of laser treatment of the capsular bag after cataract surgery at some point to improve their vision. So that's something that we should assess.
Thank you. So Ms. Wade has asked, I'm told I have astigmatism, plus I had LASIK eye treatment about 25 years ago, as well as a torn retina about 12 years ago. Is she still a viable candidate for new lenses?
Right, Miss Wade, you've been through the wars. You've had quite a lot done. So the most important thing is that LASIK eye treatment does not stop you having cataract surgery. So if you've got cataracts, it's definitely not a problem to have a cataract surgery. For your astigmatism, you could discuss toric lenses. However, because you've had LASIK, chances are that that would be less appropriate for you because it's less predictable what the outcome will be because you've had previous laser surgery. The other thing is that the torn retina does not make a difference to have cataracts done. The only thing is that you have to be aware that you have the tendency to have retinal tears, as it were, that you're at risk. So that's something you have to keep at the back of your mind if ever you have symptoms again. But none of the above stops you having cataract surgery, and it can improve your vision significantly. So that's not a problem and not something to worry about.
We have a question from Ms. Gurney, who says that she lives a long way from Benenden, and are there facilities for patients to stay at the hospital? So I'll take this one. We do not have any facilities at the hospital for you to stay, but fortunately we are located in a very lovely area that provides B&Bs and hotels close to the hospital. So should you make contact with the hospital, we can give you a list of these different hotels and B&Bs that you can stay in. And I think at the moment that is all of the questions that we have received. So should anybody have any questions, please feel free to call the hospital or to call the eye unit. We'll be able to answer any further questions that you might have. Yep. So as a thank you for joining this session, we are offering a free consultation for a limited time, a call back from your dedicated private patient advisor, an email with the recording, treatment information and loyalty reward points, and updates on news and future events. We would be grateful if you could complete the survey at the end of this session to help us shape future events. If you would like to discuss or book your consultation, our private patients team can take your call up until 8 p.m. this evening or between 8 a.m. and 6 p.m. Monday to Friday using the number on the screen. Our next webinar is on acid reflux treatment, which you can sign up to via our website. And so on behalf of our presenters and our expert team at Benenden Hospital, I'd like to say thank you for joining us today, and we hope to hear from you very soon. Thank you and goodbye.